Hi, I'm Molly Sullivan with Golfers MD, your source for all your golf health, fitness, and injury information. Golfers are prone to ACL injuries, which are caused by a hyperextension to the ligaments of the knee. ACL injuries make the knee less stable and can make the golf swing and sudden pivoting movements difficult. The pain and injury will cause golfers limited mobility and misplay. Today we visit with Dr. Michael Meow, sports medicine orthopedic surgeon, to tell us more about ACL injuries.
The ACL is a ligament that connects the thigh bone to the shin bone. The ACL serves to prevent the shin bone from sliding too far forward. An ACL tear allows that shin bone to slide excessively. An ACL injury occurs most commonly with a plant and twist type of maneuver. Occasionally it will occur with a blow to the knee. When you have an ACL tear, typically you'll notice a pop and immediate swelling to the knee, difficulty weight bearing, and a great deal of stiffness. Once the initial symptoms resolve, an ACL tear will typically prevent an athlete from running, jumping, or cutting, as the knee will be unstable. The treatment for an ACL tear depends on the degree of activity that the athlete needs to perform at. For an athlete that does not require high degrees of planting, twisting, or jumping, bracing or exercise strengthening is probably sufficient. More commonly, the high-level athlete that requires running, jumping, and twisting will need to undergo a surgical reconstruction to replace the torn ligament with a new piece of tissue. The athlete that has an ACL reconstruction typically will not be cleared to play in a running, jumping, or twisting type of athletic event until at least 4 to 6 months at the earliest. Occasionally, the rehab will last 9 to 12 months, depending on the degree of injury and the associated other injuries.
ACL that is surgically repaired is a long rehab process. And again, I'd say around 6 months, even a professional athlete to get back on the field. And I've treated a couple of professional baseball players that have had ACL tears, and they have actually said it was actually a year and a half after the ACL repair and fully rehabbed that they just forgot about the fact that that leg was injured. So it takes that long for the body to recover from that kind of an injury. It's a long rehab process that includes a lot of different types of exercises. The balance exercise is very important so that the ligament can be cased with the muscle to get it out of trouble next time it's close to tearing again. Strengthen the hip and trunk, strengthen the quads, a lot of stretching exercises. So the rehab is pretty intense, but again, it's a minimum of 6 months.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with GolfersMD.com. Remember, at GolfersMD, health equals performance.